Okay, class. In this video, we're just going to demonstrate how to treat the Ganglion cyst. It's going to show you the video to demonstrate how to treat this problem. There are some different techniques. You will see here we introduce two different techniques of treating this problem. So firstly, you must try to identify the affected area. And all what you need to do, you're going to push the cyst towards one end, towards your hand. You can use your thumb, your both thumb. Okay, that's all. That's all how you can treat this problem. The reason is because of the cyst. This cyst is actually kinds of fluid in the cyst. So the treatment will be try to break the cyst. Once the cyst breaks, and then you can heal the problem. But after you break the cyst, you can put some like a coin or even gauze, a few layers of gauze and put the tape there, so to increase the pressure on the affected area, to prevent it happen again. The second technique you can use is you can try to use the theory edge needle or even the injection needle. You can prick the cyst, but also remember this technique is more painful. You're going to prick. You don't withdraw the needle out of the cyst, but withdraw back to superficial and change the direction. As you can see, there's some fluid coming out, and you can squeeze out the fluid. Afterwards, you're also going to use the gauze to increase the pressure of the affected area. Before you perform these treatments, you must disinfect well for the affected area. And then the third one, in different area, this is in this part. Similar to the previous one, you put your thumb here. You see later you put your thumb here and you push towards the hand. How to break the cyst? Actually, we try to push the cyst against the bones, the next to the cyst. That's why we push the cyst to one side and then try to move your wrists outwards and backwards. So try to push the cyst against the bone. Yeah, that's all. Thank you for your attention.